Ladies, I need you to hear this clearly because it's not just important, it can change the way you experience healthcare in your own life from this moment forward. I am Dr. Annabel. There are 6 questions that I hear older women asking in doctors' offices all the time. Questions that seem innocent, even smart, but the truth is, they can work against you. They can subtly tell a doctor that you're uncertain, that you're willing to settle, that your health isn't your priority anymore. And that's dangerous, because you've spent decades taking care of everyone else, and now it's your turn. You deserve care that reflects the wisdom, the energy, and the life you still want to live. So I want you to listen carefully because I'm going to teach you not just what not to say, but how to reframe these questions so that every appointment becomes an opportunity to advocate for yourself, to demand the attention your health deserves, and to feel confident that your body is being seen, understood, and respected. And before we dive in, I want you to commit to yourself. If you've ever felt dismissed at a medical appointment, leave a comment, share your experience, because you're not alone. Hit like to support this message and subscribe so that together we continue to change the conversation around aging, women's health, and vitality. Let's start with the first question I hear way too often. Should I even bother at my age? I understand why this comes out. You've spent a lifetime putting everyone else first, raising children, holding families together, working hard, enduring challenges, and often receiving little acknowledgement for all of it. And now suddenly, when something goes wrong with your own body, you ask yourself, should I even bother? I want you to hear me clearly. This is one of the most damaging statements you can make in a medical setting. It reflects a deep, internalized ageism that society has whispered to you for decades, that you're less important now, that your health can take a back seat. And when you voice that question, a doctor, even subconsciously, can take it as permission to stop offering the best care, to limit options, to coast. But here's the truth. You wouldn't be asking this if you didn't care, if your body, your life, and your future weren't worth the effort. So let's flip it. Instead of asking if you should bother, say, what is the best approach to help me stay healthy, independent, and vibrant for the next decade or more? That simple shift changes the entire tone. You're no longer timid, you're planning for the long haul. You're showing the doctor that you are intentional about your health, that you still have goals, and that age does not disqualify you from quality care. And this is not hypothetical. I've seen countless patients come in with decades of unexplored symptoms, chronic conditions quietly building, simply because they didn't feel worthy of proactive care. And once we reframed the conversation, once they approached appointments with curiosity, confidence, and assertiveness, the difference was palpable. Better tests, more personalized care, and yes, better health outcomes. Now let's talk about another seemingly smart question that's actually dangerous. Is this just normal for someone my age? This is tricky because it sounds reasonable, rational even. But when you say it, what you're really doing is giving the doctor a shortcut to dismiss your concerns. Let me give you an example. Imagine you're experiencing fatigue, memory challenges, or unexplained joint pain. You mention it, but then qualify it with, is this just normal for someone my age? Instantly, a doctor's mind can take the path of least resistance and say, well, she's older. Aging explains this, nothing urgent. But fatigue could be anemia, thyroid issues, undiagnosed diabetes, or early heart disease. Memory problems might be vitamin deficiencies or early cognitive decline. Pain could be arthritis, yes, but it could also be nerve damage or autoimmune conditions. And when we hear the word normal, especially paired with calm acceptance, it signals that you might be okay with minimal intervention. Here's the powerful alternative. Instead, say, I'm concerned about this symptom. I want to make sure it's not something serious, and I want to stay ahead of it. That keeps the doctor thinking, investigating, and collaborating with you. It transforms you from a passive patient into an active partner in your health. Aging may be inevitable, but dismissing your symptoms is optional and potentially dangerous. Another question I hear constantly, and it breaks my heart, is, I don't want to be a burden. Women, you are not a burden. Let me tell you why this thought is so ingrained. For decades, society trains women to carry the emotional and physical load of everyone else. You've canceled your own appointments to drive others, ignored your own symptoms to care for grandchildren, perhaps endured pain silently to help a friend or neighbor. And now, when it's your turn to care for yourself, you feel guilty for asking for attention. But here's the truth. The healthcare system is already too willing to give minimal attention. If you preface your concerns with, "I don't want to be a burden," you'll receive exactly what you've signaled, the bare minimum, a rushed explanation, no discussion of options. Instead, try this. "I'm committed to staying independent and healthy, so I want to fully understand what's happening." This simple statement communicates assertiveness, clarity, and self-respect. It shifts the doctor's perspective from offering sympathy to engaging in meaningful collaboration. You are never a burden for advocating for your health. The real burden is delaying care and losing options. Now here's one that seems rational on the surface. What would you do if you were me? I understand why this seems like a smart question. You're trying to tap into your doctor's expertise, but here's the subtle danger. When you ask this, you're handing over the steering wheel of your health to someone who may not share your priorities, lifestyle goals, or experiences. A doctor may project their own life circumstances onto your situation, leading to advice that doesn't truly serve your priorities. I remember a patient named Helen, age 67, who wanted to continue hiking and maintain an active lifestyle despite osteoarthritis. She asked her doctor, "What would you do if you were me?" The doctor, younger and sedentary, advised against a procedure that would have improved mobility. Helen left disappointed, merely accepting a lower quality of life. When she reframed the conversation to focus on her lifestyle goals, risks, and benefits specifically for her, she received a treatment plan that allowed her to continue hiking comfortably. This illustrates the importance of centering conversations on your life, your goals, and your body, not the doctor's perspective. Empowerment in your healthcare is non-negotiable, and it begins with phrasing questions that honor your life and your body. A fifth question I hear, almost apologetically, is, "I heard this online, but it's probably silly, right?" Let me tell you something important. Curiosity is not silly. Asking questions, bringing in research, and seeking clarity demonstrates that you care about your health and that you are engaged. But when you preface your curiosity with self-doubt, you've already discredited yourself. Instead, say, "I came across this, and I'd like your professional opinion on whether it applies to my situation." This communicates initiative and respect while signaling confidence. Doctors actually appreciate engaged patients. It shows investment in outcomes, and it invites a richer discussion. Never apologize for being informed. Finally, "Are you sure? I don't really understand, but okay," is the question, or rather the silence that can cost you your health. Many women nod, smile, and pretend to follow instructions because they feel embarrassed, rushed, or overwhelmed. But silent agreement is dangerous. It leads to taking medications incorrectly, misunderstanding treatment protocols, or missing critical warning signs. It's crucial to remember, your understanding is your responsibility, and it is your doctor's responsibility to ensure you understand. If something isn't clear, you must ask and ask again until you do. Ask them to slow down, simplify, or provide written instructions. This is not rude, it's essential. Your health, your life, your independence depends on it. Now, I want you to imagine going through an appointment using these principles. Imagine the confidence you carry when you frame questions in ways that demand attention, respect, and thoroughness. Imagine leaving the office knowing that every symptom, concern, and goal has been fully considered. This is not hypothetical. I have seen women who were dismissed for years suddenly have their health transformed because they learned to advocate effectively, to reframe questions, and to insist on clarity. They regained mobility, independence, mental clarity, and energy they thought were lost to aging. And the best part is, it didn't require special tests or expensive treatments. It required presence, confidence, and strategy in how they communicated with their doctors. Let's take a deeper look into why this matters. Aging is inevitable, but decline is not. Your body still responds to interventions, nutrition, exercise, preventive care, and yes, attentive medical guidance. But only if you speak up, only if you ask with clarity, only if you refuse to minimize your worth. Every year, decade, and experience you've accumulated gives you a wealth of insight about your body. That wisdom is your secret weapon in healthcare. Doctors cannot replace it. They can guide it, interpret it, and offer interventions, but they cannot know it unless you communicate it effectively. And this is what I want you to take away. No question is harmless. Every word shapes the outcome. Every phrase either empowers or diminishes your agency. So take control. Choose your words with intention. Assert your knowledge, your curiosity, and your commitment to a vibrant, independent life. Let's also talk about lifestyle context. Medical appointments are critical, but so are the daily choices that maintain and improve your health. Nutrition, movement, sleep, stress management, and social engagement all play enormous roles in preserving independence and vitality. When you advocate effectively in medical settings, it complements your lifestyle choices. For example, a patient reporting fatigue might discover, through careful evaluation, that a vitamin deficiency is causing lethargy. With the right treatment, combined with proper nutrition and exercise, she can regain energy, improve mood, and prevent further decline. Each interaction becomes a stepping stone toward the life you want to live, rather than simply managing decline. Another layer I want to add is mental and emotional health. Asking questions with clarity, reframing concerns positively, and refusing to minimize your needs doesn't just impact physical outcomes, it strengthens mental resilience. Women who leave appointments feeling confident in their understanding, empowered by their questions, and validated by their doctors often report higher overall well-being, reduced anxiety about aging, and greater satisfaction with life. This is a cascading effect. Confidence in healthcare decisions breeds confidence in life. Let's explore what happens when you consistently implement these strategies. Imagine 6 months from now, every appointment you approach with assertive curiosity. You bring notes, ask focused questions, and insist on clarity. You are no longer apologizing for your concerns. The result? More accurate diagnoses, more appropriate treatments, and a stronger partnership with your doctor. You start to notice small improvements: less fatigue, less pain, more clarity, more energy. Your independence is preserved. Your ability to engage in the activities you love, gardening, traveling, spending time with grandchildren, is enhanced. And all of this began with small shifts in how you communicate, how you frame questions, and how you refuse to settle. I want you to leave today understanding one simple principle: words matter. Every word you use in a medical appointment has the potential to either empower or diminish you. When you stop minimizing, apologizing, or surrendering, you gain control of your health trajectory. You stop being a passive participant in your own care and become an active partner. Age does not limit your health potential. Your choices, your advocacy, and your actions do. And here's the final empowering thought. Advocating for yourself isn't just about avoiding mistakes or delays. It's about creating a life you can thrive in, a body you can trust, and a future where independence and vitality are not optional but expected. So I want you to commit today to this new approach. No more asking if it's normal, no more minimizing your concerns, no more silent nods, no more apologizing for your curiosity. Speak clearly, assert your priorities, ask for clarity repeatedly if necessary, and frame every question in terms of your goals, values, and lifestyle. You are worthy of comprehensive care. You are deserving of attention, respect, and time. You are capable of influencing how your health journey unfolds, and it starts with how you speak, how you ask, and how you refuse to settle. This is your body, your life, your future, and it is not too late. The moment you choose to advocate for yourself effectively is the moment you begin shaping your own vitality and independence for decades to come. Remember, every doctor, every appointment, every conversation is an opportunity to assert your worth, protect your health, and plan for the life you want. Do not let age or societal expectations tell you otherwise. You are capable, intelligent, informed, and deserving, and when you leave the office after asking the right questions, feeling understood, and having a clear plan, you'll walk out not just with a prescription or a test, but with confidence, control, and empowerment that will ripple into every area of your life. Ladies, your health matters, your questions matter, your understanding matters, and your life, vibrant and independent, is absolutely worth the effort. Never stop asking, never stop clarifying, and never stop advocating for yourself. You are your best health advocate, and no one else can do it better than you. Subscribe, like, and share, because there are many out there who deserve to hear this.